how to use your portable oxygen cylinder. Welcome. This video will take you through step by step how to use your oxygen cylinder and safety tips about maintaining your cylinder. Your Dolby Vivisol home care technician would have explained the precautions to be observed when storing, handling and using your equipment, and we will go through these again throughout this video. Different types of cylinders. There are three main types of oxygen cylinder: pediatric cylinder, large static cylinder and ambulatory portable cylinder. You have been provided with an ambulatory portable cylinder. It is vitally important to store your cylinders safely. They are designed to be stored either upright in a secure position or lying down so they are not free to roll about. In addition, protecting your cylinder against contamination from everyday items such as hand creams, alcohol rubs and detergents is advisable. So wash and dry your hands thoroughly whenever possible prior to handling your oxygen cylinder. Your healthcare professional who ordered your oxygen will have advised you when to use your cylinder, and our home care technician would have taken you through your equipment upon install. If you have any problems, then call Dolby Vivisol immediately, day or night. For patients in Scotland, please call 0800 833 531. For patients in England, please call 0800 917 9840. Things to remember before you start using your oxygen cylinder. Only use your oxygen cylinder in a well ventilated area. Never place the cylinder by curtains or cover with clothing. But most of all, never smoke or allow someone else to smoke near you whilst you are using your cylinder. This includes e-cigarettes. Also, do not use your cylinder near open fires, gas cookers or any naked flame. Inspect the static cylinder to ensure that all parts are clean, dry and free from damage. When a new cylinder is delivered, the dial will be pointing between the green section on the contents gauge. Attach your oxygen supply tubing to the oxygen outlets by gently pushing the tubing onto the outlet. Check that the setting is set to 0. Turn on the oxygen flow by turning the open-close dial on the side anti-clockwise. Set the correct flow rate by turning the flow rate selector on the top of the cylinder until your correct flow rate is displayed in the window. It is important to adhere to your flow rate set by your clinician. Place your cannula or face mask onto your face as directed by your healthcare professional. You are now set up. When your oxygen cylinder is no longer needed, it is very important to make sure you have turned the oxygen flow off correctly. Failure in doing so can enrich oxygen levels and present a fire hazard. Close the cylinder by turning the open-close dial on the side clockwise and try not to use excessive force. Wait a few seconds, then turn the flow rate selector on the top of the cylinder back to 0. Ensure your cylinder is then stored securely and safely back in its dedicated storage location, ready for when you need to use it next time. Troubleshooting. If you are not getting any flow of oxygen, make sure the tubing is not trapped, blocked or kinked. You can check the flow by placing the cannula or tubing to your lips and feel for the oxygen flow coming through or not. Alternatively, check for flow by placing the end of the tubing, not the cannula, in a glass of water and watch for bubbles. If bubbles do not appear, check if flow has been selected and there are no leaks. If a flow is still not evident, contact Dolby Vivisol. We hope you now have a better understanding of your oxygen cylinder. Should you have any difficulties, please contact us. For patients in Scotland, please call 0800 833 531. For patients in England, please call 0800 917 9840. You may have been provided with a low flow regulator which attaches to your oxygen cylinder. This will enable a very low oxygen flow rate to be delivered and is most commonly used for babies and children. You need to use the low flow regulator to match the exact flow rate you have been told to use. We will now take you through the low flow regulator and show you how to use and take care of this device. Prior to use, you should inspect the low flow regulator and the oxygen cylinder to ensure that they are clean, dry and free from damage. You should also check the contents of the oxygen cylinder to ensure you have enough oxygen left for your intended activity. A cylinder is deemed full when the needle is pointing within the dark green area of the gauge. Attaching the low flow regulator to the cylinder. The cylinder has two different oxygen outlets. The low flow regulator should be inserted into the Schrader outlet. This is done by gently pushing the regulator into the outlet. A click will be heard indicating that the regulator is correctly attached. Turning on the cylinder. Adjacent to the contents gauge is the open-close dial. Turn on the oxygen flow by rotating the dial to the open position. Do not use the flow rate selector on top of the cylinder at any time. This should always be set to 0. Setting the correct flow rate. The flow is set by rotating the dial on the low flow regulator until the correct flow is displayed in the window. You will feel and hear a click as the dial is rotated between the different settings. Close the cylinder via the open-close dial on the side. Turn the flow rate on the regulator to 0. Be sure to store the equipment as advised by your Dolby Vivisol technician. It is vitally important that these items are kept clean, dry and free from risk of contamination. Please ensure you store the regulator somewhere safe, as they are easy to lose but hard to replace.